And a very warm welcome, everyone. I am Dr. Nalini Kaushik, and on behalf of ISW Council, I welcome you all to today's session on breaking myths and barriers around thyroid cancer. In fact, this is in continuation of the ongoing series as we observe September as Thyroid Cancer Awareness Month. So thyroid, it's a small butterfly-shaped gland at the base of the throat. And despite that small size, it sort of controls and regulate many significant bodily functions, such as production of hormones that help control heart rate, blood pressure, body temperature, body weight, and many more. So therefore, it is sort of self-explanatory that how important and how important a well-functioning thyroid gland can be. And to reflect further on this, today we are joined by Dr. Shruti Kate, who is a medical oncology consultant and head department of medical oncology at CG Manavata Cancer Center, Nashik. An alumnus of Lady Harding Medical College and Maulana Azad Medical College, Dr. Shruti was also associated with Tata Memorial Hospital in Mumbai. Dr. Shruti, many thanks for sparing your valuable time and joining us today.
Thank you, Nalini, for this kind introduction, and thank you for giving me this opportunity to interact with the board. Thank you.
Thank you so much, Dr. Shruti. So, as we are undoubtedly aware that thyroid cancer has many associated myths around it, and it does reflect, many times, on the increasing number of cases and miss and delay diagnosis, and oftentimes, on the treatment side as well. And therefore we feel that it is very critical to have such a discussion, for people's better awareness, because in health and specifically for cancer, awareness is, one of the key element that we say is, it is the driving factor. So, setting the context, Dr. Shruti, for today's discussion, let us start with understanding, thyroid, in a very simplistic manner, that, what really is thyroid gland, and, what are its important functions in our body.
Okay.
Over to you.
Like you very rightly mentioned, the thyroid gland is a butterfly-shaped gland, which is an endocrine organ. It is situated here in the base of our neck anteriorly. Okay, in the front, that means. So, it is a very important organ, okay, and it produces thyroid hormones which are required for our development right from our birth, even when the child is not born within the uterus. Since that time, this hormone is very essential to regulate the body functions, brain development, and later in the life, maintaining your body's heart rate, temperature, growth. Everything is in control of this very important organ. It is very many times missed. We don't notice that gland unless and until it is visibly enlarged or something. But this is the most important endocrine organ, which is actually right in front of us.
Yes.
So yes, so very important topic of selecting, myths and facts related to this organ, because many a times it is neglected, and we many times we come across things like, it's a good cancer to have or something of that sort. It is considered to be a very an organ which is not very contributory to your existence, but it is the exact opposite. So we will be touching upon on all these things, but in a nutshell, it's a very important organ which is required, and for your well-being at all the stages of your lifetime, during puberty, like I said, in utero, when the baby is not even born, for your brain development, then during our pubertal growth spurt, then during our reproductive age group, and even later. So at all time points, its function is absolutely essential.
Thank you so much, Dr. Shruti. And I think after hearing you, I think all I can say is that, despite the size, I think we cannot underestimate this particular gland for its size, because even before, like you said, that we are born, it has a huge role to play. And of course, after we are born, in many other development stages, of our body. This is a very critical organ, and I just gland of and I hope that everyone who hears this conversation today stands well informed, or specifically on the relevant side. So as you said that this is one gland or a one part of the body which has so many what do you say, the myths associated with it, right? So I would be covering one by one certain myths that we more often than what we come across, and if you can just sort of decode all of that for us. So okay, firstly, so is it true that any lump or a nodule in thyroid means that it is a thyroid cancer? And alongside that, given the bodily placement of the gland that you said that it's right there in front of us, is it possible to self detect the cancer?
Exactly. So it is absolutely not true that any nodule in the thyroid gland, which is visible or not visible, is cancer. It's absolutely not true. But every nodule should be investigated. Okay. So
Right.
supposing you can feel a lump or you can visibly see a nodule in this area. So we need to do a sonography to see what it is. And 70 to 80% of the times it will be a benign nodule only, and it is going to regress with time or with treatment depending upon what it is. So we need to investigate what it is and then decide on how mild it is. It depends on very many factors of what that nodule could be, depending on what the patient's age is, what is the location of that nodule, what is the
Right.
activity of that nodule. And when many tests can help us know what that nodule is doing. Actually, is it
Right.
just sitting there, or is it producing something in the body, or is it a cancer nodule? So when we investigate, we are focusing all those tests to find out how benign or malignant that nodule is. But it's a fact for sure, if you know that you have a thyroid nodule and if you've noticed that it has suddenly increased in size, then you
Right.
definitely have to um, um, uh, find out what change has happened, whether that nodule, is there a bleeding in that nodule, or very many times then it could be a cancerous a change that has happened. So that
Right.
is important. uh,
Right, absolutely. So, like I said that, when a person, they see that kind of a change, because as you said, this is a very prominent sort of, placement of that particular gland in our body. Is it possible to self-detect, or if somebody, if a person finds that kind of, a nodule or something in the body, what would be the way to go about it for the patient?
yes, it is absolutely possible to self detect, but it is required to take an opinion from a good physician or a surgeon to who will actually be checking certain other things which would be related to the history. What are the accompanying symptoms uh, that would be
Right.
related to the gland hyperfunctioning or hypofunctioning, depending upon whether the thyroid hormones in the body are in excess or they are less. Those can produce certain symptoms. So that physician, that surgeon is supposed to find that out from the history. So patient will be aware of those symptoms. He will be able to tell you yes or no, or will be able to focus and
Right.
bring that out when asked.
Right.
But that needs to be assessed by a physician. So
Absolutely.
definitely patient can find out if there is a nodule, but then he needs to take opinion, and then
Yes.
coupled with a good history taking, coupled with a good examination, there are certain tests which will be
Yeah.
required.
Absolutely. And I think, again, reiterating that self-awareness, and self-consciousness, and, being observant of the changes in the body are very important. But yes, any, guidance, like that, that is taken from the expert is the, real way out for conditions like these. So, Dr. Shruti, in India, we have seen, the incidence of goiter at a certain point, last in like in certain decades ago was really high. specifically in India. So, is there a correlation between goiter and thyroid cancer in India?
Like you very rightly pointed out, the incidence of goiter has reduced. Yes, there are certain reports which say that low iodine intake is associated with the cancer, but that in the risk factors, for any disease, this comes very down. I mean, I like there are other risk factors which are more associated with development of cancer. So this is a risk factor in certain reports, yes, but with iodinization of the salt, which is universally done in the country, that incidence of symptomatic goiter or a goiter resulting in developmental delays in children and all, that is coming down definitely.
Right.
But I would want to tell you that thyroid cancer is one of the cancers for which the incidence is increasing, and also the
Yeah.
incidence is increasing in younger population.
Yeah.
So so it does not, it is not matching. The incidence of goiter is coming down, but the cancer is rising.
Right.
So there are other risk factors also which are beyond goiter or beyond iodine deficiency.
Absolutely. And I think this actually, again, brings me back to the question that I had a follow up question for you. That, again, talking of the incidents, because you just pointed out to that particular aspect, that first of all, is it true that only women are prone to thyroid cancer in India? Again, and like you said, the incidence is, growing. So is it like, what is the correlation between your gender and thyroid cancer? And what are the factors, since you said that goiter is going down, thyroid cancer cases are going up? What are these risk factors? Do we have certain studies which has pointed out that what is that causing factor for thyroid increase of thyroid cancer in India?
Yes, these are the two most important questions for this awareness talk. Okay, so first thing is I'll take them one by one. First is that the incidence of
Yes.
cancer, thyroid cancer per se, is higher in women. That is true for India also and world also. We do not know what is the reason for this, but this doesn't mean that the thyroid cancer is, only specifically related to female gender. So while asking the question, you said that is seen only in with females. It is not like that, but females are 2.5 to 3 times more prone to develop this cancer. Okay,
Right.
and that we do not know what the reason is, but yes, the incidence of this cancer is higher in women. uh, Going to the age, see, on an average, the patients of thyroid cancer are mostly, in their midlife. So from the third to fifth decade of their life is the time when you get diagnosed with the thyroid cancer. This is a productive life time, and a younger population. It's this is not the usual time to get diagnosed with cancer, which is seen overall. So that notion also, that like all cancers, this cancer happens when you are 60 plus, it is not the case. This happens in the younger population in the third to fifth decade of your life. Coming to the risk
Right.
factors
Okay.
for any cancer, there are some modifiable risk factors and there are some non-modifiable risk factors. So by virtue of being a lady who is 38-year-old, I am predisposed to developing breast cancer. Okay, when I become 45-year-old, this predisposition will be higher. When I turn 55, this predisposition will be higher. So with my increasing age, my predisposition increases, but this is never nil at any particular age, and this is
Right.
not in my control. My age is going to increase. So
Right.
the genetics, the age, and the sex are the non-modifiable risk factors. So the DNA with which I am born with, I cannot change that. I cannot change that I am a female. So by virtue of that, I am predisposed to develop breast cancer. And like we are talking about thyroid cancer, of course, thyroid cancer. So for thyroid cancer also, age and sex is a predisposition, female sex is a predisposition.
Right.
And the third, genetics is very important.
Right.
Supposing you have a family where you have had thyroid cancer patients who are your first degree relatives, then you should be very cautious. And now, there are genetic tests that are available, and I can go and find out if I have that abnormal mutation in my blood or not.
Right.
So be most important thing about cancer awareness is, be it a cancer of any part of your body, you have to be well aware of your body, of your family structure.
Right.
If we have a predisposition, just thinking that ना डॉक्टर के पास जाऊंगी तो कैंसर हो जाएगा क्योंकि फैमिली में तो है. I know that I have a
Right.
family predisposition. Doctor is not going to give me
Correct.
cancer.
Yes.
And even whenever I have a doubt, also at that time, confirmation of that doubt doesn't give me cancer. It just picks
Yeah.
that cancer. So
Right.
that is important. And thyroid cancer is one cancer which is very much linked with very common thyroid cancer associated syndromes, in which there could be
Right.
uterine cancer, breast cancer associated with thyroid cancer. This is one syndrome. I don't want to take complicated names, but
Yeah.
there could be some cancers which are associated with thyroid cancers, and these can run in your families as syndromes. So
Right. Right.
whenever there is a strong family history, or I would say, even if there is any family history of thyroid cancer, you should be meeting a genetic counselor who is going to make a family tree for you, and then would be telling you
True.
about all the possibilities of these syndromes. And then it's a blood test, you can do it and confirm it, and that is going to help you in first periodic screening of your body, because like I said,
Correct.
it can be associated with other cancers also. And per se, for
Right.
thyroid, if there is a gene that is abnormal, which is very strongly associated with thyroid cancer, there are provisions like total thyroidectomies in children to prevent them from developing this cancer.
Right.
So like I said, this cancer happens in the reproductive age group, and it's not a very good cancer. These genetic cancers are usually the ones which create problem in treatment. So the
Correct.
common cancers are sporadic, which are not related to genetics, but the genetic cancers are not the good ones. Okay,
Right.
so
Right.
that is one point, that we need to be very aware of our family structure, and we should not be ignoring any family history of
Right.
thyroid
Right.
cancer. And then there are some modifiable risk factors. So obesity and being overweight has been linked with thyroid cancers. Then history of radiation. So small kids
Okay.
who have lymphomas, they sometimes require radiation in this part of their neck, because there are
Right.
glands which could be involved. So
Right.
now, with the advancements in treatments, we are always concerned of not giving any treatment which has a possibility of development of some other cancer in the future life. But supposing if that radiation was given long time back, when that information was not there, or it was unavoidable, then if you have received, I mean, like, radiation in this area, then you have a higher predisposition of developing thyroid cancer. Also,
Right.
certain younger breast cancer patients who receive radiation to the breast, they could be receiving some radiation dosage to this part, because these glands, hormone glands, are very sensitive structures, and
Right.
their cells are constantly dividing. So all the cells in your body which are constantly dividing are very predisposed to damage from radiation. Now, some other radiation exposure examples, like we talk about the atomic bomb explosions and all.
Yeah. Yeah.
These situations we don't see in our daily life or routine, but Getting unnecessary CT scans of the neck in small kids is not advisable, because
Yeah,
howsoever small it may be, but it's a radiation exposure. Unless and
correct.
until something is absolutely necessary, we should not be
Right.
subjecting our children to that. That's important.
Absolutely. Thank you so much, Dr. Shruti. This was a very comprehensive yet very simplistic way of explaining that, who are prone, who are more prone, who amongst the entire population group, which is the certain, subgroup which needs to be more cognizant of, and, what could be the potential risk factors here. And I think with this, I think by now we have discussed the incidence, the prevalence, and also, a bit on the diagnosis side of it. And before we move on to another very critical aspect, which is a treatment, I think I'm also curious to ask one question about the diet factor in thyroid related cases, because there are many other aspects related to or anomalies related to thyroid gland per se, which is hypothyroidism, hyperthyroidism, etc. And I think, like you said, women in their reproductive years are more prone to thyroid cancer, but we have also seen that women in a certain age group are also more prone to any other aspect related to thyroid. Of course, men too are, but in women we do see these conditions very often, hyper and hypothyroidism. So in those cases, it is said that diet management, and
Yeah.
regulation of diet is extremely critical. So is there a co-linkage between diet and when any anomalies such as cancer as well when it comes to thyroid gland?
See, so one thing is that you need to have a normal iodine intake in your diet. Then again,
Right.
depending upon whether you are on a thyroid suppressing treatment or a thyroid replacement treatment, your diet would be different. So it is always advisable to all the women or people who are taking treatment. They should be taking treatment under guidance of proper endocrinologists, okay, who will be monitoring you very closely. And just for example, I would tell you that after the thyroid surgery, we sometimes we give a radioactive iodine treatment, and at that time, it is very crucial to keep the gland hungry for that treatment to work properly. So
Right.
at that time, regulation of thyroid hormones in the body and keeping that thyroid hormone level suppressed is very important. So it needs to be done very accurately for the treatment to be successful. In the same way, I would suggest all these patients to take proper dietary advice under the supervision of your endocrinologist. And of course, it is important to take care of your salt intake, your iodine intake, and keep monitoring. The blood tests need to be done regularly, because many times we come across patients की एक thyroid की tablet चल रही है and last test कराया था 5 years back. So that is not correct. Maybe that was a temporary gland dysfunction. You do not need thyroid treatment now, and you are just unnecessarily taking it. That is also an issue. So it is important to be mindful of what treatments we are subjecting our body to,
Right.
and why it happens that pregnant ladies, reproductive age group ladies, or pubertal girls get diagnosed is because at that time the thyroid requirement, hormone requirement is more. Body needs more thyroid hormone when you're pregnant. At that time, if your diet is insufficient, then you are going to develop hypothyroidism or a gland enlargement, and that could be affect, if you're pregnant, that could be affecting your baby. So that is important. Suppose you're already hypothyroid and you're become pregnant, at that time your daily requirement of hormone has increased, so your dose needs to be increased despite the
Right.
report may be normal, but the new normal will be set by the endocrinologist for you now, which would be taking more tablets or increasing the dose. So that is important to be. And these like I said, these hormones control your blood pressure, temperature, your general well-being. So these things do affect us, you may not be getting overt signals, but your uh, harmony of your life, or your homeostasis of your body, is absolutely in control of these glands.
Absolutely, absolutely. And I think again, very, very great, explanation. I think the audience who's watching us today should stand, much more aware on the relevance of this particular, howsoever small gland, yet the impact it has on our body and its, related functions. And before we come to the closure, because, we are, moving against the time right now. But then, if we could just specifically also, if you could reflect on the treatment side of thyroid cancer as well, that, once it is diagnosed, what are the prospects for treatment for thyroid
Okay.
cancer?
Okay, so I will simplify and I will not take a lot of time on this. Treatment of thyroid cancer is simple, I would say, but it needs to be properly done. It needs to be properly done. A messed up treatment is going to, get you landed in trouble. So, even if there is cancer in the thyroid gland, the amount of surgery required may be different depending upon your risk stratification. If you are low risk, intermediate risk, you need a smaller surgery. If you are high risk, you need a bigger surgery, and
Right.
involvement of nodes to be removed and all that. If you do an incomplete surgery for a high risk patient, then that patient is going to have a outcome which is not good. Okay, so surgery is the mainstay of treatment. Surgery followed by radioactive iodine treatment, that is also an important constituent of the treatment. And it mostly the thyroid gland treatments for the most common cancers are these. And
Right.
then sometimes for the thyroid cancers which are not resectable, radiation can be given. And supposing if the cancer has spread, or it's not possible to remove the entire tumor, in that case there are certain molecular drugs, therapies, which are just tablets which can be easily taken by the patient, are available. And now the treatment is very much precision based. So we don't treat all thyroid cancer patients. I am a medical oncologist. I have seen how over these decades, the treatment has become precision based. So now all thyroid cancer patients are not treated similarly. We do a signature of their tumor, we see what mutation is present, and then we give tablet which is specific to that mutation. And supposing if the mutation is not there, then there are certain other set of tablets which are available, which can be taken, and the lifespan of patient can be increased. So these
Right.
treatments have response rates which are as high as 70-75%. And on an average for 1.5 to 2 years also, they can give you responses, and following which you may require to change the treatment.
Right, absolutely. And I think just one point, that okay, once a patient, gets the treatment done, and they have a, of course, like you said, that the survivalship rate, or the, the precision of treatment is pretty high in, thyroid cancer. But are there any aspects that a survivor of a thyroid cancer should be more cognizant of?
Yes. So because with the thyroid gland, there is a small gland called parathyroid gland, which
Yeah.
is also sitting alongside
Yeah.
the thyroid gland. So
Yeah.
supposing if someone has required a total removal of thyroid gland and parathyroid gland to, control the disease, in that case, along with the replacement of thyroid gland, you will have to take calcium replacement, vitamin D supplementation also for the rest of your life, because parathyroid gland
Yeah.
is important for the well-being of your bones.
Right.
And maintenance of calcium levels in your body, which are also
Right.
very, very critical for your existence. So definitely lifestyle modifications, taking treatment, which will be continued for the rest of life, is an important aspect post treatment. But
Right.
this is nothing in front of a patient who has become, cancer free and is going to live a life
Right. Right.
which will be absolutely normal like he was before. Only
Right.
thing is that treatment requires precision and a good, very good follow up. That is also important.
Absolutely. Absolutely. And thank you so much, Dr. Shruti, with this. While we come to the close of our today's discussion, but I think we're really thankful and grateful to you for sharing your, first of all, giving us your valuable time, but also sharing the knowledge, the expert knowledge that you have accumulated over the period of time, and also shaping it in a very simplistic manner so that, everyone who's watching, the public who would be watching, is much more aware. And more often than not, that awareness which really needs to come from a doctor. Many times, patient do face that those avenues do not exist. But I think, such sessions are very helpful for us to, support the patient community at large in India. So thank you so much. We come to the closure, and this session was supported by Zai Pharmaceutical under its public awareness initiative. And we hope that, we continue to have similar sessions in future as well. Thank you so much, Dr. Shruti.
Thank you, Nalini. Thank you for your kind words. And I thank Isai for arranging this meeting. And it's absolutely important for all of us to be aware so that we take care of ourselves and our loved ones, our family members. It's very, very important. Thank you.
Absolutely. Thank you so much, Dr. Shruti, for this.